The U.S. is no stranger to the nursing shortage, with the pandemic escalating the issue, leading to burnout nationwide and many nurses choosing different careers. Nurses in the Stateline feel the pain of this problem as well, with hospitals doing as much as possible to alleviate the problem. Our 13 WRX's Dylan Valencia is giving us a closer look at how this issue hits us at home right here in the Stateline. Good morning, Dylan.
Yeah, that's right, Manny. Good morning. Well, you're right when you mentioned that COVID has escalated this problem a lot, a problem that has already existed for several years, but also other problems when it comes to potentially patients disrespecting nurses and other hospital staff. Now, I did speak to one nurse here in the Stateline who works at Mercy Health, and she shared how she has seen this problem firsthand. Take a look.
During COVID, I would say it was very noticeable. It was hard, scary.
Jessica has been a nurse in the Stateline for 5 years. Working through the pandemic, she saw where the industry had shifted and a shortage begin.
Nobody knew what was going to happen. Nobody knew what the outcomes were going to be. It was kind of like going in blind. Those people depend on you and they rely on you, and you have to, even though you might be feeling scared, you have to put on a brave face for them and really let them know that you're there to support them and take care of them.
There was a shortage even before the pandemic. The pandemic has really pushed people to the limits. People have seen more death than they would normally. Also, what it has caused is that people have remained inside. Socialization wasn't as widely available, which caused people to struggle with mental health and ultimately more anger. That impacts how our nurses every day deliver care because people are more angry than ever.
Jessica had close friends leave the industry because of burnout, while others stayed in departments that didn't work with clients directly. Although it has been challenging, she stays in it with her mother as an inspiration, who is also in the field.
Even on the hard days, I just think about what I'm doing, and it really drives me to go in there and be positive and work hard and really be there for my coworkers. And like if I don't show up, that's one less nurse on the floor. If I don't show up, that's one less patient, like that's a patient getting maybe potentially less care.
Thankfully, the shortage is easing compared to 2021. However, it still exists. To combat this, hospitals like Mercy Health work to provide tuition reimbursements and several programs, ultimately sending a call to action to our community.
So our ask of the community is to help us really energize nurses to join the field by taking a moment to acknowledge it, treat the caregivers with respect always, because they're here to help.
Mercy Health actually works with 245 schools to help recruit professionals here and bring more nurses on the team. And actually, Jessica says she wants to see more interaction between the hospitals and the high schools to get high schoolers even interested in the field to begin with. And while the employment is getting much better compared to 2021, there's still a lot of room for growth. We will have more information on those programs on our website, WREX.com. For now in Rockford, I'm Dylan Valencia with 13 WREX.